Hello fellow doctors and anesthetists. In today's video we are going to discuss hypoxia. It is a very important topic for FRC and EDAIC, so let's get started. We will start with the definition. Hypoxia is inadequate supply of oxygen or the inability for tissues to utilize oxygen at cellular level. It can be divided into four types. The first type is hypoxic hypoxia. In hypoxic hypoxia, the partial pressure of oxygen in blood is less than 12 kilopascals. It can be because of a low FiO2, for example, inadvertent hypoxic gas delivery during anesthesia. It can be because of hyperventilation, which can be opioid induced, diffusion impairment like pulmonary edema and pulmonary fibrosis, ventilation perfusion mismatch, for example, COPD, asthma, and LRTI, and shunts like atelectasis. The second type of hypoxia is anemic hypoxia. In anemic hypoxia, the partial pressure of oxygen in blood is normal, but there is inadequate oxygen carrying capacity of the blood. It can be because of a low circulating hemoglobin level, which is known as anemia, or it can be because hemoglobin is bound to some other gas like carbon monoxide poisoning. The next type of hypoxia is stagnant hypoxia. In stagnant hypoxia, the partial pressure of oxygen in blood and the oxygen carrying capacity of the blood is normal. However, this blood is not able to reach the tissues and organs because of a poor perfusion. An example of this is cardiogenic shock. Next type of hypoxia is histotoxic hypoxia. In histotoxic hypoxia, the tissues are not being able to utilize the oxygen that is being supplied to them by the blood, and this is seen in cyanide poisoning. Now we will discuss oxygen hemoglobin curves in a normal patient and in these four types of hypoxia. Now the first graph that you can see is the oxygen hemoglobin dissociation curve of a normal patient. You can see that the arterial oxygen is 99%, which corresponds to a partial pressure of oxygen of 13.3 kilopascals. The venous oxygen saturation is 75%, and it corresponds to a partial pressure of oxygen in venous blood of 5.3 kilopascal. And the last point that you can see is P50. It is the partial pressure of oxygen which corresponds to a hemoglobin saturation of 50%, and it is equal to 3.5 kilopascals. Next diagram that you can see on the screen is of hypoxic hypoxia. In this you can see that both the partial pressure of oxygen in arterial and venous blood is decreased. Next is anemic hypoxia. In this, the partial pressure of oxygen in arterial blood is normal, but in venous blood it is decreased because of increased extraction of oxygen from the tissues. Next is stagnant hypoxia. In this also, the PaO2 or the partial pressure of oxygen in arterial blood and in venous blood is normal, but it is not being delivered to tissues because of poor perfusion. And the last diagram is of histotoxic hypoxia. In this, the partial pressure of oxygen in blood is normal, but partial pressure of oxygen in venous blood is increased. This is because the tissues are not using the oxygen that is being supplied to them by the arterial blood. It is seen in cyanide poisoning. In cyanide poisoning, there is also a leftward shift of the oxyhemoglobin dissociation curve. Now we will discuss about oxygen content. Oxygen in the blood is carried in two forms. It can either be in dissolved form or it is bound to hemoglobin. We can calculate the total amount of oxygen in blood by combining these two forms. So here is a formula for calculating the oxygen content. It is equal to bound oxygen plus dissolved oxygen, and so is equal to hemoglobin into 1.34 into oxygen saturation plus PaO2 into 0.0225, where Hb is the hemoglobin concentration, 1.34 is the Huffner's constant and tells how much oxygen is bound by 1 gram of hemoglobin. SaO2 is saturation of oxygen, which in arterial blood is 96%. PaO2 is partial pressure of oxygen, and 0.0225 is the amount of oxygen dissolved in 100 ml of blood per kilopascal partial pressure of oxygen. So when we use this formula to calculate the arterial oxygen content and venous oxygen content, it comes out to be approximately 20 ml and 50 ml respectively. Lastly, we are going to see what happens to partial pressure of oxygen and oxygen content in arterial and venous blood in different types of hypoxia. You can see that all the four decrease in hypoxic hypoxia. In anemic hypoxia, the partial pressure of oxygen in arterial blood is normal and the rest of the values decrease. In stagnant hypoxia, all the values are normal. In histotoxic hypoxia, the oxygen in arterial blood is normal, but that in venous blood is increased. Now these values can be asked by your examiner in the exam, so you have to learn these. And with this, we end our today's session. I hope you liked it and you learned something from it. Thank you.